like to introduce our guest today. We have with us, and I've got to get your job title right, Charlie.
Oh, yeah, it's a long one.
It's a long one, yeah. Professor of Physical Activity and Public Health and Centre Head for the Centre of Exercise, Nutrition and Health Sciences at the University of Bristol. And Charlie and I have worked together for, oh gosh, I'm trying to think the first time we met, because when I worked at the BHF Centre, Charlie was a great supporter of that. So it's really good to speak to you again.
Thank you. Thanks, Elaine. Thanks, Craig. Really appreciate the chance to chat today about something I'm really passionate about. It's about strength and balance training and trying to get the CMO messages out to health professionals who are our front line on this.
Reading through your report again, I think this is about the fourth time I've read it. It's really fascinating. Some of the key findings was that it was around why strength in particular, and why often it is being named the forgotten guidelines. So I just wondered your thoughts on that, really.
Sure. Okay. So the reason you've come across that lovely phrase, the forgotten guidelines, is there have been, but to be honest, they can probably be applied to all physical activity guidelines we've had since the mid 2000s. We're on our third iteration since then, and what we noticed after the 2011 update was strength training appeared, but in very small letters in sort of the bottom corner of the information. It was something that was never picked up and promoted. And one thing we're trying to do now, post the 2019 publication of the report, is to think about how best do we communicate the different elements of all these physical activity recommendations, particularly for adults and older adults. And I'll kind of concentrate my thoughts on that because that's where the review was based. We've re-looked at the evidence. WHO have done the same thing. The US, Canada, everyone's come up with the same answer. Do strength training at least twice a week, and that as a recommendation is completely fine. There's strong epidemiology and trial data to support that. But the answer that we always get thrown back in our face is, so what do I do? And that's the bit where we've tried to give some hints in the report, and there's a nice table of different types of physical activities and their contributions to muscle function, bone health, and balance. I'll flash it up there, that one there. And because that was what people say, we get strength training is important, but what do we actually do? What do we tell people? And how can people do things in their everyday life that will make them stronger? And that's the part where we find ourselves today. And we have a communications committee that are looking and are just reporting now on how best to create messages for everybody. And everybody includes the public, but they would be different messages that we would have for health professionals, for example. And we take our brilliant physiotherapy cohort, they're trained in how to progress people through and train people safely doing muscle and balance work. But how do we then get them to implement this information in an effective way, communicate it clearly in a way that the patients understand, and then make it sticky so they go home and keep doing it in part of their everyday life? And now the hard bit comes about how do we make it actually happen in practice? Sorry, it's a very long answer.
No, that's fine. I mean, there are a lot of issues that you pulled up there in terms of general communications, I suppose, to the public versus the specifics that sit with health professionals. So if I started from the sort of general communications things, I mean, one of the things that we found out was the mixed messages that were going out, because there's lack of consistency of the language that's being used, the lack of understanding of strength training principles. And I just wondered if you had any thoughts on that in the first instance.
Yes, I think you're spot on, because the way guidelines are written, they reflect the kind of the epidemiology that they're based upon. So if a trial or an observational study talks about multi-component strength training, then we all go, oh, we all know what that means, but we don't really. Is that Dynabands? Is that shoving universal multi-gym stuff up in the air? Is it free weights? Is skipping? What is it? And often those sorts of papers don't give us that granularity. So I think the communication challenge now is not is strength training good for you? Because I think most people would probably intuitively guess that's correct. There may be some folk who don't know that, but I think generally the public understands that activity and strength is a good thing. But how do we get people to do it? Different question. But how do we communicate how best you could do this in a way that's safe and effective? And I think that's where the communication field needs to really consider now. Not making up clever psychological kind of demands on people's cognitive load and make them feel slightly, uneasy about the fact they're not doing strength training, but give them positive messages about how they can do it. So that positive framing is really important.
Yeah, and I think the other thing we noticed is the equality agenda within that, because there's often, particularly the fitness industry, makes the assumption that everybody's going to have access to a wonderful gym, and they see strength just within that lens, I suppose. And we were hearing from the physios that actually when these people go home, we need to provide activities and opportunities that they can do just as part of daily living. In the same way that we started talking about the aerobic component as daily living, we need to kind of think about strength in that context as well.
Yeah, that's a brilliant parallel, and I love that, because you and I can remember, Craig's too young, but we can remember the 80s. We can remember the fitness boom. Yeah. And the only way it seemed you could be active was to put on lycra and long socks and go to a studio and step up and down on plastic steps, or have someone shout at you for an hour and a half. And then suddenly everyone said, but yeah, actually you can get the same benefit by going walking. And we went, oh, that's good. We don't have to go to that big box and drive our car there. We can do this in a part of their everyday lives. And I think that transition from this kind of, exercise in a location with specialist equipment, blah, 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 and to actually walking's okay, is what we actually need to try and do now with strength and balance. Yeah. And I don't know what the answer is yet. And I bet there's some smart people out there who do, but that's the transition we need to make.
Yeah, great.
In terms of some of the parts that kind of came through the conversations we'd had, it's that context specific, like an individual centered approach or a patient centered approach in relation to physiotherapists specifically is absolutely critical to it. And the use of non-specialist equipment was another message that we heard quite well, and making things kind of resonate with an individual so it feels accessible is so important. And I think the other part in relation to the importance of strength, and I really like this from the rapid evidence review that the team that you led on kind of came out with, of the changing relevance of strength throughout the life course. So if it's early, middle and late age, if we called it, where it's about developing that bone strength in a younger, and then it's maintaining and slowing the decline. Because is it something around 1% of muscle and bone strength we lose per year after a certain age? So that kind of idea of it's not a one size fits all approach, and strength isn't one size fits all, because a big challenge from an equality perspective is strength's perceived as Olympic weightlifting in a gym. So back to that analogy. So the skill of the practitioner in being able to relate and translate that into a context specific way is really important. Yeah. It moves away from the technical to the softer side of it, doesn't it?
Absolutely. And we noticed this particularly when we did the work developing the pregnancy and postpartum guidelines, that again, we had strength training in there as part of something you could do, but there was a lot more safety concerns about what's appropriate, etc. And giving examples of things that will maintain your strength, not make you stronger, but maintain your strength, was where we started with. So Curran do the same things. You're about to get your own lifelong weight training course by having a child. Trust me, because you'll be picking that child up, and the progression will be perfect. As the child gets heavier, you'll still be carrying it. So carrying in a safe and effective way is really, really important. And I suspect a lot of the back referrals that physios see are entirely based on carrying a kid on one hip, not the other. So daily examples of how we can be stronger and keep.
The recommendations you made were around the role of health professionals and other professionals within developing and supporting people to develop strength and balance. And I just wondered some of your thoughts around that and the role that they can potentially play.
Well, certainly, there's two stages here. There's a knowledge stage, which is, does everybody who has a patient-facing role or a care-facing role understand the benefits of being active and being stronger in terms of what they can do to support their people they work with to achieve this, if they want to? So there's that kind of basic knowledge. And I think the infographics were our kind of very crude first step. We shifted strength from being in the bottom left-hand corner to being in the middle, because that's actually what we need to do. But, we've got a great product, but what we don't have is a marketing budget to promote it to the health professional groups. And actually, come on PHE, come on Sport England, this is where we need to be. And alongside that needs to be high quality training materials to allow people to quickly access the basic information, and then also give them a vocabulary, almost about a menu of choices they can share with people about how to be stronger and improve their balance. So that's the two stages there, particularly when it comes to health professionals.
The other thing that we found, which I think is an interesting situation for a lot of health professionals, is particularly physios. There is an expectation, I come with a problem, you treat the problem. And then it's that, well, how do you weave into that the longer term behavior change that would be required to continue to what we term strength for health and well-being, for want of a better way of putting it, as opposed to that specific strength that's part of a treatment plan. Have you got any thoughts around how that, how we square that, I suppose, in a certain way?
Well, first of all, I acknowledge how difficult it is, because it's hard enough to get people to comply with their arm rehab exercises than it is for their overall strength. And so I appreciate that's really difficult. But there is a seed that can be sown about actually just being a bit generally stronger. We're doing some nice work for the Centre for Aging Better, interviewing 60 adults between 50 and 60 and 70 around their physical activity experience, particularly in COVID in the last 12 months. And people are saying they are feeling more tired, less strong and weaker than they were a year ago. And actually, we've almost got this wonderful detraining experiment that we've done by putting people at home. And correspondingly, we may see the kind of the symptoms of increased frailty and falls and sarcopenia at a population level. So how do we get people to do things? How do we help them, support them, encourage them to become stronger doing these everyday activities? And that's where I think we find ourselves up against. And what I loved about the report that you gave, a really clear pathway of some really nice basic strategies that people can deploy during their conversations. You can sow a seed the first visit. You can say, hey, did you try any of those activities we thought about? Have you thought about some things that you could do every day that might make you stronger? And you pick that up at the next one, and So, I really like that, because that's very real and very usable. And the challenge will be, managing this. And I have worked in clinics with our 7.5 minutes per person. But
yeah, it is a challenge. Yeah.
But there can be some. So sorry, I'm going to get on my high horse now. But there is a background noise that we can do as a nation from our public health agents, sports agencies, to tell people that strength, one, matters, it's important, and this is how you can do more of it and keep yourself stronger for longer. And that national communication will make this a high value activity. At the moment, it's just a circle in the middle of an infographic, but we need to bring it alive for our population. And that's what I really would like to do. So I'm off my soapbox now.
Yeah, great. No, we agree. The other aspect of this, I think, that we found really interesting was that the group of physios we worked with in terms of gaining insight were fantastic. And the whole idea of empowering the patient and starting from where the patient is at in terms of supporting that behavior change came out very, very strongly. And I have to say, it was a joy to hear. It was an absolute joy to hear in terms of understanding behavior change and having a real understanding of that. And I just wondered, in terms of some of those materials and so forth, we often hear that health professionals are really interested in behavior change, but they have limited training in it. Have you any thoughts around that area at all?
Well, I think it's, you and I were back in the 90s, Elaine, we're challenging this with the work at the centre at Loughborough. How do we engage health professionals and care professionals in a physical activity conversation as part of their work, whether it's directly dealing with that limb that they need to rehab or their general kind of everyday life. Still need the same things. We need the correct and safe information and knowledge about why it matters, and that kind of background that everybody has around, let's say, a disease area, that this is how it's caused, this is why we do it, this is how you can do it safely, and the activities that will help. But the clinical magic that every single clinician who's listening to this brings every day to their judgment, that's why you're paid, that's why you're a physio, that's why you're brilliant at doing that. So we're not saying don't do that, we're saying do that, but do that in a way alongside some other strategies that allows these changes that we're asking people to do, their behaviors, to become more sticky, to become tackier, to become embedded. And it won't work first time. You have to keep going at it. If it did work first time, you'd never have any repeat business. But we all know that happens in healthcare.
We're aiming to influence and change the behaviour of our patients or our participants, but to get that kind of smooth and consistent experience for our patients throughout the care pathway or just throughout their physical activity experience, that consistency is really important. And I think we heard quite a few times instances where sharing practice as to, well, how, I get the theory, I've read the report, but how do you actually do it? What works for you? And I think that was one of the real strengths and what brought our working group together, Elaine, really well. And like you say, they were brilliant. It was an opportunity for them to come together and talk about something from a very like-minded position. So creating those systems is really, really valuable. I think goes without saying. But are there any other examples that kind of come out where that's happening already? Because if this peer idea is there where we like to copy, it's a natural human thing, I guess. Are there any other bits that stand out, Charlie?
Well, first of all, I think the concept's really strong, because if you think about how physiotherapists are trained, they're trained by sort of tell, show, do, and that's exactly the right pathway. So yes, I think that's much more effective than having someone like us as a talking head on the end of a video screen saying, oh, you should try doing this. No, being in the room and saying, actually, I do it this way. What do you think? How can we make it a bit better is really powerful. Other institutions that learn that way are the military. That's exactly the way the military learn. They do the theory, they go out and practice, and they come back and debrief and do it better next time. But they all make the suggestions in the room together at the same time. So as a way of learning and improving the whole quality across the whole group, it's exactly the right way forward. No, I don't know many other ways that other people have done this like that. I think learning tends to be very individualized in our kind of education sector. You tend not to learn as a group, you tend to learn as a individual. You may be taught within a group, but it's up to you to kind of pick it up and develop that way forward. And that requires a strong sense of knowing where you're at the moment. So if you don't know something, you don't know where you're at. So it kind of doesn't work necessarily. As someone who's trained in education, that I find that a bit strange. So, working as a group, we all travel at the speed of the slowest is probably a nicer way of doing it. Might be a bit more harder, might not go so quickly, but everybody kind of benefits. And of course, the patients get a consistent service and message, because not necessarily, they may not see the same person next time. So, that's actually really important. So I love the idea, Craig. It's great.
And in terms of what next, I know that you've got other pieces of work going on in terms of looking at strength. What other plans have you got for the future in this area?
That's $1 million question. We have to, there's a research game to be played, which is to make sure that we've got all the right research pieces on the board to say our area is valuable and important. And there's a few missing pieces. And I think probably the missing pieces, certainly in the UK, are trials that have been successful outwit a clinical population. And that's harder to get funded and tricky, but I think that's where the challenge is. There's some exciting work coming out of the University of Birmingham fairly soon, which is looked at strength and balance training over long term. And I think that's worked really well with that particular population. So it's about scaling that up and taking what we know is effective and trying to embed it into everyday practice. So there's two fronts. There's still some missing kind of prevention front, kind of trial work, and then there's some scale up work on implementing. Where there is actually, interesting enough, I think, really poor science. The science of getting effective evidence-based interventions into practice is still, in our field, quite slow compared, let's say, to medicine, where that pathway is much quicker. I don't want to wait 8 years to be reading something that's was effective 8 years ago is suddenly being rolled out into practice, and we still don't know if it's embedded or not. So the challenge for PHE, the challenge for the new health promotion board within DCHC and Sport England and others is to think about how do we speed up that pipeline from good science, and I also say good practice, because actually I think good practice is often way ahead of the science. How do we get the good practice, the good science, and then share it and make it implemented? That's the bit that needs to work on. I'm on the soapbox again, sorry.
Well, Charlie, thank you so much for sharing your thoughts with us. It's been really interesting.
Complete pleasure, thank you.
Yeah, and hope to speak to you soon.